let's talk about the thyroid. The thyroid is one of those key glands. It's an endocrine gland, and it's absolutely essential. What makes it essential? And what's the reason everyone needs to watch this video? I'll tell you why. The thyroid affects bone tissue, so bone cells. It affects muscle cells, cardiac muscle, regular muscles. It affects digestive cells and neurons. And so when I say that, if you don't have it, they don't work right. So you need them, you need the thyroid to make this work right. It also involved in hydration of the tissue. It's also involved in metabolism, because at all these cells, it tells the cells use oxygen to make energy. And so if it's not doing that, you don't make energy. And there are a host of complications, which I will get into. This is an introductory video, which will follow a series of videos about the thyroid. This is very common in psychiatry, and now we'll explain why. A little bit more about how the thyroid is produced. In the central nervous system, there is the hypothalamus. I've talked about it before, but it's a gland, and I would call it the master control, not a gland, but a master control center of the brain. And it has a direct link to the pituitary. So it's here, and the pituitary is like, if you drew a straight line in here, if you took a pen, went right into your nose, you'd hit the pituitary. Above that is the hypothalamus. And there's like blood vessels that connect the two. So the hypothalamus says to the pituitary, it sends out thyroid releasing hormone. It says to the pituitary, make thyroid hormone. The pituitary sends out thyroid stimulating hormone. This is important when we start talking about labs, which I will. So now the pituitary tells the thyroid, okay, thyroid, it goes into the bloodstream, because now the thyroid is right, you see that little bump right there? That's your thyroid. Right there. Mine has no nodules, thank God. I'm feeling it right now. It's on the left and the right side of that. So then the pituitary sends a message to the thyroid through thyroid releasing hormone to produce thyroid hormone. T3, T4. T3 is triiodothyronine, and T4 is thyroxine. Thyroxine is the prodrug. The body really just uses T3. T4 is broken down into T3. T3 is the active compound. Why do they call it T3? Because it has 3 iodines. Why is T4 called T4? As 4 iodines. Yes, iodine is essential for thyroid function. Okay, now we've got that cleared up. So I have a patient comes in. Let's just get real now. Comes into my office and has low thyroid. Now, in the back of my head, I know that the thyroid works on heart, muscle, bone, digestive system, hydration of skin, and metabolic rate. So I look at the patient. If the thyroid isn't working, I look at them and think, gee, your metabolism must be down because you're always cold. You have no energy because your thyroid is down. You have constipation because the thyroid controls the digestive system, normal functioning of digestive tissue, and you become constipated because the thyroid controls bowel motility and secretions from the bowel wall. So it doesn't really work well, so you become constipated. Your exercise tolerance goes down because it controls the heart, both what's called cardiac output, the speed of the heart rate, and how much blood each pump produces goes down. Someone may have muscle weakness and bone fractures. If I hear a bone fracture, I think, okay, could be a thyroid issue because the bone has been weakened. And when you look at them, their skin is all dry. Their hair is dry. Their nails are broken. They have weight and they have no energy. And the thyroid, let's remember, also affects the neurons. Without thyroid, you don't get normal neuron sheaths, you don't get synapses, you don't get dendrites. So the beginning, middle, and end of a neuron doesn't get produced, and it is not maintained. So people get confused. They have trouble with cognition. They get depressed. That's in a low thyroid state. But in a high thyroid state, well, what happens? It controls metabolism, right? It controls muscle. It controls heart, muscle, regular muscle, bone, digestion, hydration of tissue, and neurons. Well, in a high thyroid state called hyperthyroidism, low thyroid is called hypothyroidism. They become agitated, irritable, excited. They have an increased respiratory rate, so an increased breathing, increased heart rate. Their heart is beating very fast. They may lose weight because their metabolism is up. Once again, the neurons in the heart are not working well. They become excited, could become manic. They become very irritable, very restless. Weight loss. And then they have these problems with their heart because it's beating out of sync. The brain isn't not working right. They can't think straight. They can come manic. Oh, and they get diarrhea because the tissue of the digestive tract is not working right. So we looked at patients with hypothyroidism. We looked at patients with hyperthyroidism. There's other conditions. There is something called Hashimoto's thyroiditis, which the autoimmune system attacks your thyroid and kills it. It's a lymphocytic thyroiditis. The lymph system, lymphocytes attack it and kill it. Graves' disease is another thyroid disease where your thyroid is altered. And then you can have goiters where the thyroid gets very big, thyroid nodules. This is important in psychiatry because a lot of people who present either manic, depressed, anxious, irritable, I check their thyroid. And I supplement with supplemental thyroid hormones, either T3, T4, or both, triiodothyronine or thyroxine. Usually it's thyroxine, it's generic, it's cheap. Synthroid is the name. And when you supplement it, it takes about, I would say, 4 weeks to 8 weeks for the full effect of that to come about. But they could start seeing benefit within 2 weeks. Something's going on in our food supply that too many people are getting thyroid problems. I think either toxins or maybe some people are eating, what hurts the thyroid? Soy, tofu, edamame, cabbage, kale, pine nuts, peanuts, sweet potatoes, cassava, peaches, strawberries. Those are damaging to your thyroid. Things that are good are things that have iodine in it. Eggs. Eggs are good for your thyroid. Baked fish, frozen yogurt, roasted seaweed, macadamia nuts, Brazil nuts, good for the thyroid. That's for another lecture. But this is the basic understanding of the thyroid. And without normal thyroid function, you will not have a normal mood. So it's key for me to always stay on top of thyroid. And I pick it right up. Someone has cold intolerance, constipation, funny skin, funny hair, crackly, peely skin with little red patches here. Their nails are breaking. Their hair falls out, and they break their bones. First thing I think, you broke your bone, let me check your thyroid. Your hair's falling out, let me check your thyroid. The skin looks really bad. I check the thyroid. And the opposing would be hyperthyroid, manic states, irritability, anxious, weight loss. They also have problems with their skin, hair. I check the thyroid. So that's the basic part 1 of the thyroid talk. Thank you.